Hello, this is Dr. Sandra Cabot. Welcome to my series of videos on high blood pressure. These 3 videos will be very helpful for people with difficult to control high blood pressure and provide you with a holistic approach to overcome the causes of high blood pressure. They will also help you to reduce the risk of potentially dangerous complications of high blood pressure such as strokes, heart attacks, and heart failure. This video is my second video on a series of 3 videos, and this video will look at some lifestyle changes and look at the blood pressure medications that may be necessary to control high blood pressure. Persistently high blood pressure is a common problem and is known as hypertension. Hypertension means that the pressure inside your arteries is too high. High blood pressure can be called the silent killer, as it slowly and insidiously damages the walls of the blood vessels and the internal organs supplied by these blood vessels. The organs most vulnerable to damage are the heart, brain, and kidneys. Even if blood pressure is only moderately elevated, over the years it can cause huge damage and is dangerous. Unfortunately, many people underestimate the damage that high blood pressure can cause. For example, they have an aversion to taking their medication, forget to take their medication, or have a confused belief system that they control their blood pressure with stress management alone. The reality is that the proper control of blood pressure needs a holistic approach, which if implemented can prevent organ damage and add many years to your life. You may need to make some lifestyle changes. Begin with simple daily changes, such as try to quit smoking, limit your intake of alcohol, reduce your sugar intake, and reduce stress levels. Try to do some regular exercise, things like walking, swimming, an exercise bike, light weights, Pilates or yoga. Exercise is proven to lower high blood pressure, and 30 minutes daily is effective. If you have not exercised for a long time, start gradually and build it up to a level that you feel comfortable with. Good quality sleep is very important to control blood pressure. If you have poor sleep associated with snoring and interruption of breathing, known as apnea, insist on a referral to a sleep laboratory. These sleep problems can be treated very effectively, and they are very high risk factors for high blood pressure, strokes, and heart attacks. Now let's look at the blood pressure medications. A bit of pharmacology for you. Now, blood pressure medication is often needed and is usually effective. It needs to be prescribed by your doctor. It may only be needed in the short term while you improve your diet and lifestyle. If you have a fatty liver, prescribed blood pressure medications, known as antihypertensive drugs, may not work as well as they should, and it is important to improve your liver health. Watch my videos on fatty liver, which explain how to reverse a fatty liver. They're on YouTube and also on liverdoctor.com. Do not stop or change your blood pressure medications without checking with your own doctor first. The drugs commonly prescribed for high blood pressure include ACE inhibitors, angiotensin receptor blockers, calcium channel blockers, beta blockers, and diuretics. ACE inhibitor medications act by opening up the blood vessels. This is called a vasodilator effect. ACE inhibitors prevent an enzyme in the body from producing angiotensin II. Angiotensin is a hormone that helps regulate your blood pressure by constricting or narrowing blood vessels, and increases water and salt retention. Another group of drugs is known as angiotensin receptor blocker drugs, or ARBs, which work by blocking receptors at the hormone angiotensin axon, which are found in the heart, blood vessels and kidneys. Blocking the action of angiotensin helps to dilate the arteries to lower blood pressure and prevent damage to the heart and kidneys. Another group of commonly prescribed drugs are calcium channel blocker medications, which work by preventing calcium from entering the cells of the heart and arteries. Calcium causes the heart and arteries to squeeze or contract more strongly. By blocking calcium, the calcium channel blocker drugs allow blood vessels to relax and open up. Another group of antihypertensive medications are known as beta blockers, and they have been around for a long time. They work by blocking the effects of the hormone adrenaline. They make your heart beat slower and relax the blood vessels, which in turn reduces blood pressure. Beta blockers can also help the heartbeat rhythm to stay more regular. Beta blockers also reduce anxiety in many people. Indeed, some people feel much better on beta blocker drugs. Beta blocker drugs cannot be taken by people with asthma, as they can cause wheezing, but otherwise they are generally very safe. Sometimes beta blockers can cause fatigue, but this is usually overcome by taking the medication twice daily instead of taking the daily dose all at one time. The dose of the beta blocker can also be reduced to a level where you do not get any side effects. Note, some people need to take 2 different types of blood pressure medication together and take a smaller dose twice daily rather than a larger dose at one time. For example, a beta blocker drug can work well with an ACE inhibitor drug. It is often good to start blood pressure medications in a low dose and gradually build up to a level that controls your blood pressure. This way, side effects can be reduced way down. Now, natural therapies can be used along with blood pressure medication. However, you should not take any herbs if you are taking blood thinning drugs unless first checking with your own doctor. If you are taking diuretic drugs, you should not take potassium supplements unless first checking with your own doctor. So some people do need blood pressure medication, and it takes a little bit of trial and error to get the dose correct. In my 3rd video on high blood pressure, I will discuss the best diet to lower high blood pressure. I will also discuss the best natural supplements to lower blood pressure and make your blood vessels healthier. So thanks for listening, and if you enjoyed this video, please share it with your friends and click like and subscribe.